It's Dr. Trish Leigh. Today I want to talk to you about how to improve therapy goals by including brain-based science. So when I say therapy goals, this time I don't mean neurofeedback therapy goals. I mean more traditional therapies. So this video is actually for therapists or for parents who have children in traditional therapies like occupational therapy, physical therapy, speech-language pathology, really any type of therapy, vision therapy, etc. So we are going to talk about how the brain functions and how we can make it work better using brain-based science. So let's dig in. Okay. First, this is just a little bit about me. My background is I started as a speech-language pathologist. I earned more degrees in communication, cognition, education. Then I earned PhD training in two areas. One is in child language and cognitive development, and actually language and cognitive development across the lifespan, and cognitive science, thinking about mind, brain, body connection. So I consider myself a neurodevelopmental specialist because I do have many degrees from many different areas. Okay, let's get rocking and rolling. So many of us forget that the brain is the supercomputer that is running our entire bodies. And when I say bodies, I mean our mind, everything that's happening cognitively and what we perceive as psychologically, and everything physical within our body is being run by our brain. It's the supercomputer. So you really should know how it works, especially if you're a therapist, because as a therapist, you are trying to reboot the body or the mind by using behaviors within your discipline. So traditional therapists, I'm licensed as a speech-language pathologist. I'll use speech as an example. A speech therapist tries to improve brain functioning in the speech areas by working the mouth or the mind. So depending upon what they're doing, they're using the modality to strengthen the brain area, which makes the modality work better. So that's why it's important. Okay, so let's think about it a little bit more. Here's anatomy of the brain. So I was just implying that there's speech areas of the brain. This is very simplistic, but what you can see is that there's specific areas. This is the area for speech expression, being able to output what you are thinking that you want to communicate. Back a little bit further, in Wernicke's area is the language and speech comprehension area that makes it so that you can understand what is said to you. Here we see there's the motor cortex and the sensory cortex. These are very important areas for occupational and physical therapy because many times these areas are not performing or functioning as they should, which is creating the symptoms that the person is struggling with. We have the visual processing area back here in the occipital lobe. The cerebellum is for involuntary motor movements, and sometimes, especially in neurodegeneration, the cerebellum can be impacted. The temporal lobe are very strong auditory processing areas. So if someone struggles with auditory processing or sensory processing in that way. Sometimes people have misophonia, which is a sensory processing disorder that impacts their ability to handle environmental noises. It's all because that area is not processing environmental stimuli or information coming in from the environment in real time at the proper speed. So we're going to talk about two things right now when it comes to brains. Brain areas, which we're going to break down a little bit more in a minute, and brain speeds. Okay, so let's get into it. Brain energy and brain areas. Depending upon how your brain is using energy, that will impact your ability to function in the areas we just talked about. So this is what an EEG might look like over 1 second of time. EEG is electroencephalogram. So this is actually a compound wave of a few different bandwidths. And the bandwidths can be broken down, and here we see the 5 main bandwidths from slower energy, which is called delta, to faster energy, which here we refer to as gamma, which is actually the fastest type of brain processing speed, one that we don't use that often. But from very slow or extra slow all the way to extra fast, our brain should be able to shift gears. So we use this extra slow speed, and you can see it's 1 cycle per second to keep us in sleep. It's a little bit faster, between 4 and 7 cycles per second, when we're shifting into sleep, when we feel drowsy. So when you feel tired, it's literally because your brain is slowing down. Alpha waves are when we're feeling very relaxed. Hopefully you're able to tap into your alpha waves and you're able to get into this 8 to 12 cycles per second, which is deep relaxation where you can literally just feel how chill you feel and it feels good. You don't want to stay there forever though, because then that's depression. You want to be able to get there, but then crank it back up into your beta waves. Beta actually has some bandwidths in there also. You want to try to stay in lower beta. Lower beta is about 15 cycles per second, and what that will do for you is put you in the zone. One of my favorite places to be. So that's when thoughts are coming to you. It's the hum, the rhythm, when you're doing homework and you're getting it done and it feels great because you know it and you're able to do it quickly. If you're giving a presentation and the thoughts are coming to you, you're in the zone. Your brain is running perfectly fast for you to accomplish whatever you want to be able to accomplish. If your brain's running a little bit faster, then you're in high beta. That means you're anxious. So if you've ever felt that increase in blood pressure and your heart rate is going and you feel nervous, it's literally because the energy in your brain then falls out to the energy in your body is cranking too fast. So we need that. That's a fight or flight response. We need that in very stressful situations, but we should be able to come down from that within our day. So if you have a stressful situation, you want to be able to crank it into high beta, but then come back down into low beta so you're in the zone. Then you want to be able to go home and relax with your family and be in alpha, not have thoughts running in the back of your mind. Then you want to get in bed and start feeling drowsy as you're reading, and you can feel yourself shifting into theta. You get in bed, you get 8 glorious hours of sleep, and you wake up and you do it all again. It's circadian rhythms based upon how fast your brain is functioning. Okay, hopefully you're with me. The next thing we need to talk about is brain areas. So I showed you the brain a few minutes ago with the different lobes and the sensory motor strip across the middle of the cortex. That looked like a brain, right? This is a representation that people who think about brains and energy use to be able to communicate with each other about the areas of the brain and how they're functioning. So you can see that we have kind of these circles, and they have letters and numbers that identify them. And essentially see the nose up here and the ears. This is the frontal lobe, and this is actually the prefrontal lobe. Then we have the frontal lobe. Here's the sensory motor cortex across where it says C, the central area of the brain. Back here is the parietal lobe. In the very back, the occipital lobe, and we see the temporal lobes again. So it's showing the same thing and we saw on that last brain, but it's an easier representation for professionals to be able to follow. And this is a simplified version, but you can see how there's bubbles that show us what every area of the brain is supposed to do in terms of functioning. Every area has a job, a skill or ability that it is supposed to be able to pull off with relative ease. It can do that if your brain is able to get into the zone during the day. So we have the auditory processing areas, which are actually very strong areas for emotional regulation as well. In the frontal lobe, we have attention, executive function, impulse control, and judgment. We already said sensory motor cortex. So if there's kids that struggle with sensory seeking or sensory aversion, it's because that strip's not using energy the way that it should be able to. In the back, the parietal lobe is a very true cognitive processing area, verbal on the left, mathematical on the right. So all areas of the brain are important and they all have different jobs. We also need to consider how they communicate, which we'll look at that in a few minutes. Okay, so this is brain areas and brain energy. How do we know what brains are doing? We use state-of-the-art, cutting-edge technology called QEEG brain mapping. QEEG stands for Quantitative Electroencephalogram. So what that means is we're able to take an X-ray, or we take a picture of how the brain is functioning, and it shows us every area and how it's using speed. It's completely non-invasive. It doesn't do a thing to you or to a child, and it's available now. Everybody in the world should have a brain map. I remember a few years ago, one of my kids asked me what initiative the president could take that would really forward humankind. And I'm like, free brain maps for everybody, because then everybody would see what their brain was doing and would be inspired to improve it, presumably. So, free brain maps. What EEG looks like when we glean that QEEG, this is the raw data. And the reason I'm showing you this is because these letters represent the different sites that we just saw, but you can see how these waves are all uniform. They're all about the same height, they're about the same width, and they all have kind of this rolling hills effect. This is a typical or an optimal EEG. And we're going to look at comparisons to other EEGs for diagnoses that people struggle with in just a second. So what that EEG looks like on QEEG is a green head. So basically we can see green means 0, which means optimal functioning. And when we see yellow to orange to red, it's 1 to 2 to 3 levels too high of a speed. And the blues mean 1 to 2 to 3 levels too low of a speed. Okay, so let's look at some maps. Here is, and I'm only going to show you one raw data so you can get the sense of how it's different. You can see how some of these areas, for a 16-year-old with ADHD, some of these areas are loosening up, or they stay loose across time. And really, this is only across, not even a second, it's 15 seconds. You can see how we have loosening of some of the areas. Loosening is slowing. It's slowing of brain functioning, which results in ADHD. So let's see what this would look like on a brain map. Okay, what it looks like is much too much theta, or slow processing speed. It's that speed that creates drowsiness or shifts us into sleep. Simultaneously, some people with ADHD do not have enough low beta, or that faster kind of optimal processing speed for cognitive function. So it's a double whammy, too much slowness and not enough perfect fastness. So an analogy that I use in the office all the time is in ADHD. It's like someone's driving and they have their foot on the gas at 45 to get around town, perfect speed. But if you have ADHD, your pedal is to the metal for the brake. Simultaneously, your foot's not even on the gas at 45. It's on it at 25. So cognitive processing is not only happening more slowly, it also has the brake on it as well. And you know the key to success, if you've watched any of my neurofeedback videos, the key to success is taking that foot off the brake, pushing it on the gas a little bit better, a little bit more ideal, using neurofeedback therapy. But we'll get there. We will get there. Okay, so now speech and language impairment in a 5-year-old. 5-year-olds are the perfect people to get in for neurofeedback therapy or for traditional therapies, because their little brains are more plastic, more neuroplastic than older brains. And our older brains, thankfully, are still plastic as well, but we want to capitalize on it. So actually, this is a before and after neurofeedback therapy, and these are the slower speeds right here, 1 to 8 hertz. And you can see how around Broca's area and Wernicke's area across the back of the brain also is running much too slowly. And in this after, you can see how there's dramatic improvement in 1, 2, 3 hertz, 4 hertz even. So there's dramatic decline of too much slowness, of too much braking. But the point being is that a speech and language map is too much slowing in the speech areas of the brain.